So where do people die? So we're talking about statistics now. These are 2009 stats in BC, but they haven't actually changed that much. So in 2009, about 30,000 people died. And about 15% of them died in their own home. Now, if you ask people who are dying, 65% of them would like to die at home, and that is the quoted aim of Vancouver Coastal, to allow 65% of people to die at home. So there's a disconnect there right away. About a quarter of them died in residential care. 11% died in hospices. We don't have a hospice. And about half of them died in acute hospitals. Now, can you think a busy emergency room of the worst place for somebody to die with your relatives? So look at that number, 47% and 11%, it's roughly 60%, and hang on to that number there. Because in Powell River, about 200 people die a year, and look at that, about 60% of them die in hospital. We don't have a hospice, remember. This is a nice statistic, this one. This is actually one of the nicer statistics. Of the patients in residential care, only 8% of them die in a hospital. And that's actually a sign that we're doing pretty well in residential care. So of the one area of palliative care we do well in Powell River is residential care. Residential care is patients' homes, and when they die, they usually die in their home. So that's way better than the average in British Columbia, and I think it's credit to the quality of care that's given in residential care. The average length of stay in acute care is 20 to 23 days in the last 6 months of life. I mean, of course, when people have serious illnesses, they often go to hospital, but I think we should be re-looking at that statistic. So what do people die of? Do you remember I said, what are you going to die of? All of you have thought of sudden death. You're in the minority. It's unlikely to happen. Only 3% of us are going to die from that sudden death. We're going to be shot by our jealous lover on our 90th birthday. It's unlikely to happen. The other there, the 5.6%, is just because they couldn't work out what the people died of. Terminal illness is largely cancer. Organ failure, that's COPD, heart failure, liver failure. And frailty, that's largely dementia and related illnesses like that. And I have to tell you, that is the growing industry in this province. By the time we die, most of us, that's going to be over a third. Cancer's getting less. The organ failure is probably going to stay about the same, but frailty and dementia is going up, and that's the big one that's going to happen for us all. Why is that important? Because knowing what the diagnosis is will help you organize your care. Because if you know the diagnosis, you can at least have some prediction of how the death and the dying process is going to be.